Now, while cancer screening on the whole continues to improve, many types are still difficult to detect.
Among the trickiest to spot is ovarian cancer, which is the hardest of all the gynecological cancers to diagnose and doesn't yet have a screening programme. Well, joining us now, ovarian cancer survivor Laura Moses and consultant gynecologist Adam Rosenthal. Welcome to you both. Laura, you were diagnosed in 2016. Tell us what that process was like and how you came to that position.
I was diagnosed in 2016 with stage 3C ovarian cancer at the age of 27 after 3.5 weeks of misdiagnosis with all of the common symptoms of ovarian cancer, and it was missed 3 times, and that was in part down to my age. And I carry a BRCA mutation, but BRCA mutation or no BRCA mutation, because of my age, I was geared towards looking at IBS or problems with the bowel, constipation, and that 3.5 weeks ended with a second visit in 1 week in A&E, where my suspected cancer was picked up, which is frightening because too many women find themselves in the situation that I did, where advanced ovarian cancer is picked up in A&E. And then I ended up having treatment, chemotherapy, a major radical debulking surgery, and a year of maintenance treatment to get me to remission. I was, thank God, able to hear those words, and I am just over 2 years cancer-free.
Yeah, congratulations on that. Just how worrying was it in the lead up to the diagnosis? I mean, did you ever suspect that it could be something that serious?
No, when I first found out I was a BRCA mutation carrier,
Just explain what that is.
I carry a mutation. We all have BRCA genes, and one of my BRCA1 genes is mutated. It's come down from my father's side of the family, and that puts me at an increased risk of breast cancer and ovarian cancer. And the ovarian cancer risk is not one that you statistically have to worry about until you're older, which is why it's so surprising that I got diagnosed so young. So I was more clued up on the breast side. But when I started to continuously hear IBS or constipation, I kind of plugged the symptoms into Dr. Google, and one of the first things that comes up when you put cramping, constipation, needing to go to the toilet more regularly, lower back pain, one of the first things that you find is ovarian cancer. And then I started to wonder and think, could this be more, something that needs urgently looking at? And that all kind of came out in that second visit to A&E, when my life was just turned upside down in an instant.
Adam, just listening to some of Laura's symptoms, so many of them can be associated with other things, and I guess that's largely part of the problem.
Yeah, absolutely. I think that these symptoms, by and large, are ones men and women all experience, and you and I certainly don't have ovaries, but we can get bloating, we can get tummy pain, we can get change in bowel habit. The key thing really is if they're new symptoms, or if they're persistent, going on for 3 weeks or more, you really need to see your GP as a woman and say, I've got these symptoms, and could it be ovarian cancer? And then your GP should be able to institute the right investigations for you, rather than send you off down a different path, which results in a delay in diagnosis, which unfortunately so many women, such as Laura, experience.
Why so hard to detect?
I think because it's not something people think of. Patients don't think about it, and to a certain extent GPs don't think about it, because it's a rare condition. Only about 1 in 50 women will get the disease in their lifetime. Whereas of course there are many women going to doctors with those symptoms all the time, and it's estimated that perhaps around 1 in 100 women with those symptoms will have ovarian cancer. But the hope is if they're diagnosed more quickly, that their outlook will be better, and it'll certainly save a lot of upset amongst patients, families, and indeed their GPs, if there aren't long delays, which of course create a lot of bad feeling that doesn't really help what's already a very unpleasant situation.
Is there some confusion with cervical cancer? Because women will have been for cervical smears, and if those are clear, might they think that this isn't possibly something that...
Yeah, there's been recent evidence. One of the ovarian cancer charities has put something out about this recently, in fact, that unfortunately there's a lot of misconception that people feel that a cervical smear somehow protects them against all of the female cancers, and it's very good at preventing cervical cancer because it picks up precancerous changes, but it really does nothing to detect ovarian cancer.
Laura, for somebody who's been through it and come out the other side, I mean, what would your advice be to other women who are worried right now?
that if, as Adam said, if you have those key symptoms that are continuing for 3 weeks or more, then you must go back to your GP. And if you go and nothing comes of that, but the symptoms keep going, you have to keep going, you have to keep asking, you have to keep talking. And there are charities out there such as the Eva Pill that have the most amazing tools and wealth of information on their website, people you can talk to, nurses you can talk to, where you can get the answers that you need. Because actually, as the Eva Pill says, women know their bodies, and we need to learn to know our bodies as best as we can. So you can go to your GP and say, no, I know this isn't normal for me. And coupled with that, actually, you know, women and men need to be having that conversation, because men also need to be aware. The Eva Pill also had a great campaign where they spoke about men having to being aware of the symptoms, because for every woman has a father, every woman has, you know, males in their life that they need them to be aware. So that conversation just needs to keep happening. Those symptoms, we need to know them inside out.
Thank you very much. Brilliant advice, and stay well.
Thank you very much.
For coming
Thank
in.
you.
And Adam also. Thank you.
Thank you.